Okay, I'm Dr. Arnout Note, and what I'd like to do here is present something that's very important to dentistry, and it's not just, it's conserving tooth structure. Preventative dentistry is a good word. Minimally invasive is a wonderful word that Tim Rainey coined, and I think he's dead on with his techniques and what we're supposed to do with these teeth. What we want to do is we want to preserve the natural tooth as best we can. Now, natural teeth have small defects in them, and so they get cavities down in those little crevices on the top surfaces of those teeth, and then they get decay. And if we let them go, they get big, and it will destroy the whole tooth. And what we want to do is preserve the important subocclusal substructures of those teeth so that the teeth stay strong. And we need to intervene by doing that. Now, if we take a burr, a diamond burr, or a carbide burr, or a high-speed driven burr that most dentists like to do, they will destroy that tooth. So what we want to do is not use a burr on the tooth. Okay, we can do this with air abrasion. So this technique is about air abrasion and showing how it conservatively removes what we have to remove, and then we keep the good after that. Okay, so we got Jonathan here. Let's get Jonathan back, and he's got a couple teeth that we've diagnosed that need a little bit of help. And Jonathan I think he had a brother that came in here, and he's a little bit older, and he had some cavities that I wish we could have gotten a few years ago, but we were still able to restore very conservatively, but it needed a little bit more dentistry than what we would have liked. We're going to prevent that on Jonathan by doing this. Okay, Jonathan, go ahead and move back a little bit. Just like that. Perfect. Get our light on there. This type of dentistry needs to be done with a microscope or with high magnification, or you can't see what you're doing. And then you need a good air abrasion unit that actually does remove the tooth structure very efficiently and very carefully. You can see exactly what you're doing, so you're not removing too much. And I think Jonathan's got one on his lower that we want to look at. So I've got one right here, this back molar. It's got a couple teeth. Let's look at this top left back molar. Yeah, let's take a look. Yeah. And so we're doing this without anesthetic because it doesn't hurt much. So it feels a little bit. He'll feel some, but okay, go ahead and use some water and okay, we're going to use the Diagnodent, the laser on there one more time. And you can see how the numbers now have increased rather than decreased. So that means we're picking up the infection that's inside that tooth deep in there. And then we don't want to leave that there, so we want to make sure that's cleaned out. Now there's a kind of a leathery portion of that tooth that we can kind of scoop out with a little spoon and clean it out. So we're going to remove the soft part of the tooth and leave the hard portions of the tooth. Underneath this layer, this is the infected dentin, basically. It's full of bacteria and it needs to come out. And underneath that is a hypermineralized zone that they call the clear zone. And we want to leave that. That's infected, but it's not. That's affected then, but not infected. Okay, go ahead and rinse that. Amazing. Just with a little bit of spoon excavation, we got those numbers to go way down. So normally dentists will take these teeth and they'll go ahead and put either sealants over them, so they're infected, and they just kind of seal over the top of the tooth. Maybe a triangle or something. Or they'll ignore it and do nothing and let it just go until it's too late. So there are two mistakes we don't want to make on this in this case. Guess what? Our numbers are way down. So anything less than 12 is very acceptable. And even if we did nothing, the tooth would be better off at this point. But we're going to go ahead and fill it so he doesn't get food in there. And we're going to use something that's very simple to use. It's a glass ionomer material, so it's got some minerals that help remineralize the tooth and keep it from getting, and it'll actually make it stronger again in those areas where it's been weakened. And these restorations are a little bit brittle, but in such a small space, it'll hold up for many, many years. Okay, I want you to stay open nice and big. I just want to keep it dry for just a second. So we want to remove as little of the tooth as possible and allow some remineralization to take place. And we can do that if we use certain filling materials or let the saliva remineralize those teeth. We can get that kind of remineralization. And then that's the important concept. So we're weakening where the tooth has been weakened with the natural formation of the tooth. It's had some defects in it. We've removed those cracks or those defects in that tooth with our abrasion, and then we'll go ahead and clean it out and get rid of the infection or the bulk of the infection, and the remainder can get remineralized by using some of these better materials. And this filling was extremely small anyway because we designed it that way, and so we could use glass ionomer. We could use a composite, but if you use a composite you have to be extremely careful because that material will shrink. It has a high configuration factor because of the shape of the filling. So if you do a filling, you'd probably be better off using chemical cured filling materials that shrink and mature slower than the light cured materials that we use in dentistry most often today. So, and we try to keep it simple. If we can keep it simpler, that's sometimes better. Okay, I'm Dr. Note. So what we've done here is we've done a procedure on Jonathan. He's 9 years old, I think so. He had a couple teeth that had some cavities in them. They were small, but they were definitely there, and they would have gotten larger if we would have left him alone. And so what we've done is a new procedure that's done with air abrasion and magnification with the microscope. We kept the lesion small with our air abrasion. We didn't touch the tooth with a burr. We cleaned them out. We used our special laser to see if there was any residual tooth decay left in it, which is a lot more accurate than our visual eye or a pick, feeling around with that. And so we've got it all cleaned out. And then since we were cleaned out and we didn't structurally compromise that tooth by making a big hole in it or using a burr on it, which incorporates fractures into the tooth, we were able to do that. And also no anesthetic, which is a really nice thing. He didn't have any pain today. The air abrasion didn't hurt. Sometimes patients will feel it a little bit, but it doesn't hurt like a shot or drilling into the tooth because you're not damaging the tooth. So we were able to fill that, and we had a couple options with types of filling materials we could choose. Now young kids, a lot of times their teeth will barely be erupted. They'll have a mouthful of saliva. They salivate a lot. They have a little hard time keeping their mouth open. And so if we use filling materials that are technique sensitive as far as moisture control, those are poor materials to use in a small child. So we need to use something that that can tolerate some moisture. So in this case we used glass ionomer, which has good remineralization characteristics, and so if you do get a little leakage around it, it's actually going to help remineralize that tooth. And it'll hold up really a long time because they're so small, these cavities, that even if they wear just a tiny bit, they're just going to be just fine. And then if down the road we want something a little more aesthetic when he's older, or maybe in 10 years you want to replace it with a little bit of composite, then we should be able to do that very simply with, again, with a little bit of air abrasion, no numbing required. And so we've basically saved the tooth for this patient. And he may have this tooth for another 80 years in his life, and no cavities, no fillings, no root canals, no crowns, no implants. We can prevent all that right here and now.